All right, everyone, it's 3:45, March 19th, 2024. We'll bring this Health and Human Services Committee meeting to order. We're going to start with Director McGann, Public Health.
Hello.
Everybody ready for spring and spring. Just have one resolution, request to enter into an affiliation agreement with SUNY Portland for student practical experience.
Move it. Seconds.
Further discussion? All in favor? Aye. Carried.
And then I have one out-of-state conference request for NACCHO 360. That is the National Association of City and County Health Officials. Move it.
Second, further discussion? All in favor?
Aye.
Opposed? Carried.
A lot of pages.
Yeah. Okay.
And then the director's report, 342 communicable disease investigations, several respiratory outbreaks at nursing home facilities, including flu, RSV, and COVID, which resulted in one flu death and then one death due to Acinetobacter, which is a bacterial healthcare-related illness. The COVID numbers are, I have to figure out how to send this to you in color. I apologize. That is my fault.
That's okay.
That small line there, which on mine is a nice orange, but it's yours versus the third black line. You can tell that we are far below the past 2 years in our COVID numbers. We had 109 cases in February. Unfortunately, we did have 3 deaths due to COVID in February. 1 was in a nursing home and 2 were community. All were of advanced age and several comorbidities. We did have 3 deaths. Wastewater surveillance is down, but do keep in mind this represents 10% of the county population because it is just the city of Hudson. They have not done a recent genetic sequencing, but the last one in January, the JN.1 was the predominant strain by far. Again, that is much nicer with color.
Yeah.
We have LTBI investigations. We have 9 LTBI in various stages of workup, 2 lost to follow up, and that just takes up a lot of our communicable disease time, as you can imagine, trying to hunt all the multi-step testing down.
Are they in denser housing or is there any common
Yeah.
theme?
Many foreign-born or recently come to the United States. That is most common. But there's no real apart from that, no geographic.
Or anything like that. Okay.
80 cases of Lyme so far to date, 3 anaplasma. Yes, so that's not that nice.
Is that high, that number of 80 for this time of year?
So it's hard to tell because they changed the way that we investigate them. They made it so we don't investigate as many just with the changes at the state level as far as like a true case. So I think that's a far underrepresentation.
I'm just wondering in the winter time, I know Lyme still.
Yeah. And
Maybe
diagnosed,
old enough
you
this
can be
year to kill
diagnosed
them.
with Lyme all year long too.
You could have gotten it 2 months ago.
But we
But it's the
do,
best time to be on doxycycline.
Yeah.
You're indoors most of the time anyway, right? You're out of
There
the
you go.
sun.
That's looking at the bread.
Turn that
Yeah,
around
yeah.
upside down.
That's right. The state does do tick dragging every year, and we do get information from that. And I can share that, too. We had 2 specimens submitted to be tested for rabies. We had 1 positive bat and 1 negative dog. And then we completed 1 vaccine series on a human. Environmental health, nothing really remarkable there, which is exactly what you want. And then we had 89 vaccines administered to 46 individuals. Those are non-COVID, and that has slowed down greatly from the past couple months, thankfully. Our immunization clinic has been incredibly busy, so it's starting to settle, luckily. We only had 9 doses of COVID-19 administered. And recently, the CDC has recommended a booster for over 65. We did not get a lot of calls. We're still deciding what we'll do as far as vaccination because our current supply for private, insured expires at the end of this month. We've got about 30 doses, so we're just kind of
Is it a
unsure
new
if we'll
booster?
buy more. No, it's the same formulation.
Okay.
It was recommended by the CDC that those over 65 get another dose of the most recent formulation.
And how long does it last?
It's like 6 months now.
You mean the immunity from the vaccine or the vaccine? It depends.
Okay.
Yeah, yeah, it depends. You know, an immunocompromised person would respond not as well to the vaccine, which is why, you know, they recommend another one.
Mhm.
It's expected that they'll release yet another formulation at the end of this year for along with the flu season. I'm not sure if it will be. It would be nice, and I think the goal is to have one respiratory season vaccine, flu and COVID. I don't know that that's reasonable this year, maybe next. But it's being talked about, certainly.
Well, hopefully we'll make it a little softer than the combination I did this
Yeah.
fall. We're knocked me down a little bit there. but
Yeah.
Perhaps I should have done one at a time.
And then in preschool and early intervention, we've got 27 children in the preschool program being transported to 6 locations, resulting in 12 routes.
Is that a
That is a
typo?
typo. Yes, I apologize about that. It should be $6,989.75. Comma works. Yes. There are 130 students in the preschool program. And then early intervention, the EI hub is being rolled out on June 3rd. There was one in-person training in which every county in New York State was allowed to send 3 people, which is great for us, but not so great for much larger counties when they have 30 to 40 people in that program. So it's unclear how successful that rollout will be, at least initially. There's a lot of talk about that in my with my colleagues, especially the ones that were part of the pilot program. It seems that the EI hub crashed each time that they tried to do a pilot. So that doesn't sound promising, but hopefully by June 3rd, they'll work it out. But we're quite anxious about that.
Seems to have been problematic. I remember at the NISAC conference last year, not even this year, last year, they were talking about the issues with the development of it.
Yes, I think that they've been talking about this program for about 5 years. So here we go. We'll see. Yeah, we'll hang in there for the duration. So public health emergency preparedness, working on hazard mitigation updates, threat assessment management team, and then a background checks training for the Medical Reserve Corps that we're hoping to launch in the next couple weeks. One maternal child health referral in February, 0 discharges, and then 2 cases of physically handicapped children program, both hearing impaired, and we did 3 car seat installs in February. Any questions about anything?
This is from the supervisor.
Great job.
Thank you. Thank you.
Thank you, Director. Up next, Commissioner Gibson, DSS.
Very good.
So we'll start off on the first request is to fill a social
I'll move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Second is to fill one bookkeeper position, and any backfills created therefrom.
Move it. Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Third is request an authorization to create and fill one paralegal position.
Uh-oh. It's not-
Sorry.
Okay,
Up.
I'll move it. Second.
Further discussion? All in favor? Opposed? Carried.
The fourth is to create and fill one senior social services investigator position. Very briefly, there are two positions in the agency that are social services investigators. They are, and it just doesn't make a lot of sense. I should have a senior over somebody else. So I had plenty of room in my budget as I taken several positions and sort of put them aside and not filled them of late with the idea that they're probably going to end up obsolete. So that's completely a budget neutral thing at this point to create the senior, and just makes sense for the org chart, quite frankly.
So you've had two all along and you're making one a senior? Or?
Yeah, and it's a good opportunity because it's going to be filled in-house. You're not looking at adding any fringe to it, and
So it's not like you're adding another.
I'm not.
Yeah. Okay.
And what's more is there's only one right now, so to elevate now makes that a perfect option.
Okay.
So we're making a difficult choice. All right, do I have a motion? Do I have a second?
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Okay, and then, the last one is tough. Looking to hire a part-time confidential secretary, who will be manned by Ann Delaney, who I cannot live without, and she must retire at least part-time, so,
Holy cow. Yeah.
well, she'll be around. Walked her into it.
You're such a fixture. Yeah.
I know.
Yeah.
She's awesome.
So I'd like to, she's certainly gonna come back part-time, and I have this move in my budget as well.
With great sorrow, I will do that.
Great, so.
Do I have a second?
Second.
Further discussion? Our heartfelt thanks to Ann. I'm glad she's sticking on.
Yeah, listen, Friday, I'm gonna have a lunch and a little gathering for her. All the supervisors are certainly welcome, 44 plus years. And we're gonna have a little fun with her. We're gonna talk about the price of things. And it's gonna be a good time. I got some citations, one from the local congressional district, and Dee Dee Barrett's office did one, but I just put that open to people if you'd like to stop. And she's certainly,
Good time.
I would say about, I'd say you can start coming at 1. On Friday.
This will be a virtual training. Friday morning.
Okay, well, it's afternoon, so.
It's not a surprise, is it, Bob?
What's that? Oh,
Yeah, no.
oh, no.
No, she planned it.
Well, that makes perfect sense.
Yeah.
I just didn't want to be the one to spill the beans.
Yeah.
I have to say,
Yeah.
Because.
Yeah.
So there's just one thing I wanted to bring up
You
before.
had two, Bob, didn't
I-
it? There was something added later, but it didn't get scanned in.
Yeah, so you're right. The MDT field workers, and I talked to PJ Keeler about this, that contract's gonna expire. I think it's at the end of April. It's, as I talked to PJ, he is very, very adamant that it is a money saver, that he saw just from his position alone, not having to have the ambulance and 911 called. He sees a great fit for it. I have to say I do too. My folks have really leaned on these folks. I think it's been a great cost savings to the county, and it's a county expense. I'll say it quite frankly, but I think it's better paid through these workers than through the ancillary services that go. So I'm going to be coming next month with request to renew that contract, and I wanted to give plenty of time for you guys to think about that. Contact us if you like, and certainly contact the treasurer, who's also the EMS director for the county, who can speak largely to the costs. And of course, Director Almasi here, but we're getting close on that. And I'm going to give it, we're certainly going to put our imprimatur on it from DSS perspective, given what it's been able to accomplish. Okay, so that's just a month's advance notice on that.
Is that being funded ARPA now?
I believe it was. That's what was-
I do not know where that county funding has been coming from.
I thought that's what we did is
So do I.
did some for 2 years on that.
To
If I
take
may,
a
we-
look at
For the mobile crisis assessment team.
Yeah, that's what I was gonna bring up, Chairman. I'm not sure which funding source funded what, but let's just remember, Commissioner Gibson, is talking about the MBT field support team, and then we also agreed to continue the mobile crisis assessment team. So there were two separate decisions to fund two separate programs. We have to look back collectively to see where the money came from, but,
Well, Jim would know
Yes,
if
of course.
it's ARPA money, so.
I'm pretty sure MCAT was ARPA, but I don't remember about MTT.
And that's where, because I know that's how I feel about it. I
Right.
wasn't sure that
Yeah.
MDT money did come out of
I
ARPA,
could
but
be
it may have.
confused too, but-
But in any event, we know ARPA's not going to go on forever. And so
No.
the decision will be, how do we want to pay for these services? Do we want to pay them up
So
front?
we do a lot of these things as a test run and then see how it works. So if you've got evidence that it works, then
Well, I don't have, I have our experience as an agency. PJ is the
but
one.
PJ's got some.
Yeah,
you know,
he's
data.
who you want to talk to about it. They are always out. They are seen in the park with our clients who use this.
Yeah.
They are seen, they have a vehicle. And so much of the transportation is
Handled
provided
that way
that
rather
used to
than
be done.
ambulance, right?
And of course, and it's a little late, but on the 19th of March, we're opening over on Green Street. So for the next several weeks, it's also going to be a help there. Remember, that'll be opened as early as November 1st last year and run through April of 25. And that's where they're going to steer people. So the
Okay.
community is very happy about it, having talked to some of the folks that were on that 7th Street Park Committee. So, it's just something to work in tandem together for you folks to think about. Again, I know the funding has to be thought about. I would stamp our imprimatur on it because I think it's a savings at the end of the day. It's definitely a useful service. I think that it's a savings at the end of the day.
Commissioner Gibson, if I may add something. to
Yeah.
that, I just want to remind this committee that, unfortunately, this program, this MBT field support team was initially, devised with 2 FTEs. For the majority of the 2-year pilot period, it was at 1 FTE. So it remained very effective with that 1 FTE. However, I think a lot more work could be done with the 2 FTEs, which is finally properly staffed, recently.
Yeah,
I bring this up because we have to look at the numbers, but, there's a savings there in terms of what we originally allocated. In terms of the cost, I believe the budget was just under 200,000 annually for this program.
That's an excellent point.
Those are 2 FTEs though, so we saved
Right,
over these past 2 years.
We wouldn't have spent that. That's right. That's right. So
We were also partnering with Green County.
no,
no,
That's just the MCAT.
That's-
Okay, forgive me for.
okay, so I'll be available.
So when the renewal comes up, we're gonna be looking for 2 FTEs.
There already are.
Right, but we,
It
if I understood it
just
correctly.
recently got properly staffed the way we had intended to from the beginning. But throughout the majority of its tenure, it was understaffed by 1 FTE.
So we could double what was spent and that would be a more accurate picture of what the program would cost. Because if we just recently got it to full staff.
Well, quite possibly. And if it was ARPA and there's still time to reallocate it, then that's exactly right. So
But I don't think it was. We'll look.
Yeah, it may not have, one of them was on.
one was,
It was
I
in
think
count.
it-
It was in count.
Might not be a bad idea, Bob, next month you come with PJ too.
absolutely. Yeah, unless you would like to discuss this prior with him, because he says he was very welcome to do that.
But it'd be good to.
Well, he approached me. said, well, it's funny because my contract's go. He said, no, it's, we've noticed a big difference. So they're saying something.
Good, yeah.
Because, in any event, I mentioned 19 March will be our first night over on Green Street for the Warming Center. We've already got the clients picked out that we'll take out of the hotels and put over there. I took a quick tour today and will be available to take any supervisors on any tour next week if you'd like to. I really don't know that we'll get to a grand opening as I wanted to this year. We'll just sort of run out the clock and we'll present something at the beginning of next
It'll
year.
give you a good chance to try it out, though.
It is a great test run time, and we're very excited about that. And I can give a report on that next month. So,
Great.
so I'm looking forward to that.
What's your metric for closing at the end of this year or this winter?
Well, you know, it's funny, even El Nino and all the things, we've typically, with the states not ever pushing back, we've stayed open anyway through the end of April. I plan to do that again. And we get full reimbursement on that. Okay. I would say at a much better rate for the last month here, now that we're going to be moving them over. So finally, as you know, as commissioner, I've worked with a lot of the local fraternal organizations on various different projects. We essentially act as a hub. So at Christmas time, groups, you know, work through us and we connect them up with other groups. We bring clothes, we bring coats and boots into the agency for folks. And we work with the Elks Club. We work with a lot of people at Christmas for our stocking fund. And that sort of gets my name out there. And I was contacted accordingly by the Kiwanis Club. And they said, you know, we're looking to break into Columbia County and we're told you're a good guy to bring to one of these orientation meetings. And I said, okay, sure, I'll come. And I went, and there's a good group that wants to start. In fact, it's very likely to end up at the Morris Memorial when all is said and done. You know, they brought up an interesting thing. I tend not to join. I tend to act more like the hub. But they need membership to get going. So I said, well, I'll think about that, but given my position. And they pivoted and said, well, you know, the laws were changed and corporate membership is open now. And sometimes government agencies will join that way. I said, well, I'll certainly give that a thought. Now, I haven't had a chance to talk with Rob Fitzsimmons about this, which I plan to do. I would not be opposed to doing that if that's something that the board wouldn't be opposed to, you know, DSS having a membership in a Kiwanis Club. It's apolitical, so you will have no political affiliations. They don't endorse, they don't do anything. They basically serve children and families, which is our mission. And they do it ancillary to what we're doing. So they try to see where a need might be open. They run fund drives, and there you have it, book bags and the like. I'd like to encourage it in the county because I think fraternal organizations are what made the country what it is. And the dip in volunteerism has been felt around here, as we all know. So I'd like to encourage a northbound. And so if I were to look into this and the county attorney saw no issues from a liability standpoint and no need to really look at our insurance, does the board have a fundamental problem with a corporate social services membership in a burgeoning Kiwanis Club in Columbia County?
And everyone on the board getting massive phone calls and emails about the similar thing.
Did what?
They had a marketing campaign. I don't
did
know.
they?
I got voicemails and
I
emails.
didn't get any.
I did, I got, because they do have, nationally they do, I don't know. if-
Yes, they do. Oh, yeah.
Good.
What do you think?
I'd like to see what the county attorney has to say about it.
So do I. So I'll bring that to the group as well next month. So I just kind of put that on for a last minute discussion because I went last week to the meeting and
Is that the Kiwanis Club that has the Key Club in the high schools? So they have
well, they don't have anything here right
no,
now,
but
But in-
That's my memory that.
Yes.
There was a very active Corners Club in Columbia County years
Yeah.
ago.
That's what
And
they
the
said.
key clubs were very
Matter of
active in our
fact,
high schools,
yes.
The clock on the I think the clock on the corner of the park is a.
It is. They mentioned all these things, and I thought it was sad that it wasn't still going. So I certainly don't want to discourage it, so I'll take it a little further and I'll meet with Rob and I'll let you know, okay? It's pennies on the dime, it's $35. I'll pay it out of my pocket. I don't care.
Bob, just a quick question, the Joslin, is there any movement on that? or
There's no
is that
movement on
dead-
the
Is that
Joslin.
dead in the water?
It's not dead in the water. In fact, Supervisor Scalera called me today and asked would I reach out again, and I will. It's not dead by the folks who would very much like to buy it, but the folks who have it don't
So
really
it's sort
know.
of in limbo, hasn't it?
It's in limbo and they're not
Okay.
gonna open.
Got it.
Yeah,
So they got
there's
6
no
months.
work going on.
There's nothing.
So there's 6 months of pain, there's 6 months of no revenue, right? So it just depends on how long it's gonna take them to figure
Come to
out,
their senses.
right?
Agreed. Agreed. So I'll keep you updated.
Thank you.
Thanks for.
Following Commissioner Gibson, I'm just gonna read, Director Grandinetti's report, if that's all right. I'm good with that. Okay, from Youth Director Dan Graninetti, Think Differently 2025 budget will be submitted to Commissioner Gibson this week by Lisa Galena, Cornell Cooperative Extension. The Hudson Youth Department leadership team is working on the $72,000 successful grant application from Senator Hinchy's office. May 23rd is a youth leadership banquet at the Hudson Elks Club, 5:30 PM, and all supervisors, clerks are invited. I'd like to get a hard confirmation by mid-April if people want to attend. And 52 youth, along with their parents, have signed a driving pledge with the Columbia County Clerk's Office. Thank you for submitting that to me, Director Grandinetti.
Will something about the youth, banquet go out, or has it gone out and I missed it?
Invitations.
Yeah, so we can respond.
I'll send them an email.
Thanks, that'd be great.
Yeah, there will be a flyer and all of that.
Next, we have Director Almasi. Let's see.
Thank you. Good afternoon, supervisors,
Welcome.
Chair.
Afternoon.
So relatively light agenda today. One financial resolution. This is to request an increase in the amount of what's called service dollars that we have on hand. Think of it as petty cash for care coordination program, both children and adults. The way I understand it is certainly things have become more expensive over time. The last time we asked for an adjustment, I believe, was in 2016, I think. And there's a delay, there's a lag as we go through the process to get reimbursed for these funds as we spend them. So we wanted to have an increased amount on hand to be able to be nimble, flexible, and use these service dollars for what they are intended for. So I ask for your support to increase the amount from 3,500 to 5,000.
I'll move it.
Second.
Further discussion? All in favor? Aye. Opposed? Carried.
Thank
So I
you.
just have a question. I don't know what service dollars are.
Oh, these are dollars that come to us from the state aid money to support the individuals that are served by the Adult and Children's Care Coordination Program. They pay for things like maybe clothing, maybe some food, maybe needs that an individual may have, cover the costs of an application fee for employment, things like that.
Okay, thank you.
Yes. One personnel resolution today. Unfortunately, we've received 2 resignations. One individual is just simply wanting to work closer to their home location in the Capital District. The other individual, it's not clear to me as to what prompted the resignation. But nevertheless, I ask for your support to fill these budgeted vacant positions.
Second.
Thank you.
Further discussion? All in favor?
Aye.
Opposed? Carried.
And then this general resolution has to do with Community Services Board and Subcommittee membership. We've had several folks opt out of the service, so we've invited new folks to come and participate. So I ask your support in approving these new members for the Community Services Board as well as the subcommittees.
I'll move it.
Do I have a second?
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
And then lastly, before getting to a couple of just general topic discussions, this is a general resolution requesting your support to contract with an academic institution, Wegman School of Nursing. One of our nurse practitioners has agreed to take on a student, and the school that the student is affiliated with requires this codified relationship in the form of a contract and such. So very excited to have a student, very pleased that our nurse practitioner is willing to take on that responsibility and lift. So I ask for your support.
I was a little confused on the agreement. It says that the university will provide for the supervision of students, but it looks like we're providing for the supervision of the student.
I would assume what that means is that ultimately the student has an academic-based supervisor for their curriculum and their internship.
Actually, it says on site at the agency.
I'd have to look into that then, because that's a little peculiar. That is not the case.
And I was trying to think how we would manage that.
No.
Right.
We would not.
Okay.
What happens on occasion is that that academic supervisor will come on site to discuss with our nurse practitioner that's providing practical supervision to discuss how things are going with the student.
Yeah, it says when students are in the clinical area, we're applicable. So maybe that's what the reference is.
Maybe.
Yeah.
Um,
So does this happen for a semester or 2 semesters? What's the timeline on it? I mean, I think it's a great program. I just have a couple of questions.
Sure, off the top of my head, I don't know that it's several months. It may go beyond a semester.
And this is clinical training, so it would be unpaid?
Correct.
Okay.
Yes, it's part of their academic requirement to graduate. It usually comes in the last semester of their academic tenure, that they have to secure a placement and be supervised properly.
Where's this individual live?
Off the top of my head, I don't know.
That was my
Sorry.
other question, is housing.
Yeah, I read your.
Yeah.
There's no
It's very easy.
housing is what you're concerned about?
Yeah, where
No, I'm
the,
not concerned.
It's, they're obligated to get themselves here. They need to graduate,
Right.
so
So they figure it
that's
out.
on them. They figure it out.
They find a place to
Yeah.
sublease or whatever, Airbnb.
I think they're relatively local. They drive themselves. That's usually how it's occurred. They pick the placement based on that
Sure.
proximity. We've never had anyone relocate to do their placement
Right.
with us. That would be a first.
does Rochester do online courses?
Yes.
Okay, so that may be why they could be local. I would move this. I think it's a great idea.
Terrific. Do I have a second?
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Yeah, thank you for your support on that. It is a great idea. It's good. It does require a lift on the employee's part, which is why I'm grateful.
I'm glad you got somebody willing to do it.
But everyone in the professions has needed someone to proctor that.
Right.
I, as a social worker, needed somebody to mentor me, otherwise I couldn't have graduated. So it's a giving back. It's a gift that keeps on giving, so to speak.
If I may intervene, in, I know that we get a couple of these kinds of requests too, and it is a lot of on the agency, but I know that a lot of schools are having a very difficult time finding somebody to agree to this. So.
Right. Thank you, Victoria. And it pays off in an investment in regard to that intern sometimes becomes an employee, should we as a department have a need and a vacancy. So at this time, I would like to invite my colleague and staff person, Miranda Woodstein, to join me up here to discuss one of the topics on the agenda. I think before we get to that, what may be a briefer conversation is I shared, please come on, the example of signage that I brought forth. You may remember, and I think it started in the January Home Committee. There we go. I requested your support to work with the county sign maker to create some sort of signage that would identify our building. We discussed the importance and the value of that and letting the community know who we are, where we are, who are the tenants and such. Kelly, if you could scroll down to show the other example, please. There we go. Can we rotate? Nice, appreciate it. So this is what I came up with in terms of a vision. It doesn't necessarily have to be the final proof, but I think it gives you the idea. This one, roadside clearly lets people know the address, you know, you can't miss it, hardly. The placards that are inserts are removable so that if the composition of the tenants in the building changes, you know, I understand there will be some changes coming forth relatively soon when, or the 11 Warren Street gets up and running. So we want to edit this particular sign as well as the one that will be affixed to the building itself.
My question on that is, does that need a permit from the city to locate that?
I inquired with the sign maker, I've been told we have carte blanche, they're willing to cooperate. It was brought up here when I first mentioned it in terms of, the style of the sign,
Right,
so on
yeah.
and so forth. I was told they're fully cooperative with
The
us.
city.
Yes, the city of Hudson.
There still may be size limitations. That's the only thing we should look at. Most
I was
sign
told no
laws.
sign limitations. Really, I will, before we go to print, so to speak, or
Yeah.
construct, I will make sure of that. But, I was so pleased to hear that because I agree. I thought there would be
Right,
some sort of,
At least a permit requirement and that's physical size and, you know.
Yeah,
Right.
that
If I were
really
being
surprises me.
hypercritical, I love the idea. But I think the name should be a hair bigger, maybe, and even the number could be a hair smaller, just.
I agree with you.
That's
Supervisor. I agree.
Otherwise, I think it's a great idea.
The 325 is massive
Yeah,
as
it doesn't
compared
have to
to,
be that big.
you know, do we need to include Columbia Street? I think it goes without saying, but yeah, we could tone down the size of the numbers.
And make the other ones a little larger.
Yeah, agreed. Scale.
Yeah.
Bring it into scale. Similarly with the one that would be attached to the building. And the reason I'm proposing two is, you know, there's road traffic and there's foot traffic. There is some foot traffic that comes through the park that's located to the left there of that entrance. I don't know if that park has a proper name, but you know the one I'm talking about? In between Warren Street and
That 325 is not presently on there, is that correct?
correct, no, that's,
So, yeah, I would rather see the names a little bigger, but that's just one opinion, so.
right.
But otherwise, yeah.
It could be put on this, could you have it on this?
It doesn't say street on it, no, it just says, you would recommend it?
Yes.
Makes sense.
Actually, I'm just looking at the Hudson
What is it?
regs right now, permits required. It is
Yeah.
unlawful for any person to erect, repair, alter, or repair within the city of Hudson any sign or other structure as defined in this chapter without obtaining a permit. So a permit is
I
required.
don't know if we're given a pass, maybe it's a municipality, but I'll pass that along to the sign maker. I specifically asked, I don't wanna,
I just
Yeah.
remember we had to get signs when we did construction for Habitat. We had to get the
Okay.
signs approved, so I wouldn't be surprised.
Maybe
Any
you wanna have
complaints
Brady.
from the code enforcement officer
Yeah.
can be directed to Chairman Ron, at the
Oh.
Public Works Commission.
I was gonna turn it over to Ray Chakowski, our public works.
if you support this idea, maybe the order of operations would be to first get your approval on the
Right,
rough
yeah.
idea that I can then take to him and say, is it okay for me to,
Right.
to construct this, to have the county sign maker construct this? And then City of Hudson can chime in, notify us whether there is or is not a permit process. Maybe we get a pass as a municipality. I don't know. But, I thought the first step was to bring you some rendering
Oh, yeah.
to give you the vision of what I'm.
Is 325 on the street facing side now?
No, there's nothing.
There's nothing.
And is that a double-sided sign, so you can read it from, because
It
a lot
could
of people
easily
come
be a
in from.
double-sided
The
sign.
only,
yes.
the only place you're gonna have, I think, even what you said is on the building, I think you can do almost whatever you want. It's
Right.
it's a erected
The
sign.
freestanding
Yeah,
sign.
that's the
So
one that
I think.
This version,
Correct.
right? So yes, they're,
Yeah, I think, yes,
But-
to answer your
the
question. we like
takeaway
the
that I'm
concept.
getting is,
Yeah, just,
Chairman Morrell, do you have any concerns?
No.
Thoughts? Okay.
Dan, could you make sure that we're on that sign too, please?
Absolutely, and I'm sorry, I don't mean to offend anybody that doesn't see themselves on the sign. This was taken from a previous rendering when this topic was discussed years ago. So yes, we will have every tenant that currently occupies the building on there. They will have their logo. In the case of the Department of Human Services, it gets a little tricky because we would like to have the county seal. I imagine Department of Human Services / Mental Health Center, and then the Mental Health Center, which all of you approved several years ago, has its own logo. So we'd like to have both of those. But yes, and the Healthcare Consortium has its own independent logo and things like that. So we definitely want that to be part of it.
Go back up to the top one again, because it looks like you have two colors, a red and a black. Or red and green, I can't see.
Burgundy's red, burgundy and green,
I
yes.
think the green's is easier to read than the burgundy on the brick.
I would think you'd want it to match whatever you pick this color to be.
Yeah. Well,
The
maybe
two
that's
signs
true,
should
too.
match, but in terms of color, the world is your oyster. If you told me you wanted it to be purple, and they can do it in purple.
Yeah.
Um,
Be
We're
opposed to
talking
the
concept.
open green, you know?
Support the concept.
green, to your point, Supervisor, does align itself with the other county signage. It wouldn't be the throughway green that a lot of these signs are, but it could be green. It
Maybe
could
it's
be-
time for new signs.
Well, I think whatever we decide, it should be the same throughout the county, so I don't know what that color, yeah, if that's the, if it's green, it should be.
Like you said, this is like a highway sign out here.
It is, and no offense to whoever made, it's difficult to read.
It is.
It's a challenge.
It
It's
is.
busy.
Yep.
I mean, no disrespect by that, but signage has to be very clear
And I do think
at a glance.
a lot of people come from that alley from Warren Street.
Right.
And it would be great if that were two-sided as opposed to
Easily done. We
single-sided.
talked about that with the
Yeah.
sign,
Right.
yes. All right, so I have your permission to proceed with this rendering in green for both of the signs. And I'll work with City of Hudson to see if there are any prohibiting factors, permits, et cetera.
Reach out to Ray Jakowski and have him write to the building code enforcement officer who can propose a nice proposal once you've got a, a sketch.
Finer tuned rendering.
Right.
Thank you,
So
Supervisor.
you're gonna give
That
us some
permit.
other options, like small, this, larger, that, but the same size.
Range.
I can do that if you'd like. Yeah,
They're doing it for you,
Couldn't we
right?
just call
Yeah,
it?
sure.
You know, maybe do this
Let Ray
smaller.
do that.
do these
Okay,
big,
it's
just
so
so
easy.
I know.
You just drop it
Next
down.
month, and I'll
You
also
don't have to
pursue.
write it down.
So the way I interpret it is I have your tentative support. You'd like to see more renderings, but I will go ahead and work with, Ray Jerkowski and City of Hudson. Fair?
Yeah.
But we won't break ground on anything or drill holes yet.
You got it.
All right, thank you. So this leads me to the final item, which is why Miranda is here. You may remember, I believe it was in January, I talked with the committee about the desire for the Department of Human Services to offer letters of support to individuals seeking emotional support animals. This is a very charged topic. We had some spirited discussion here amongst ourselves at that time. There is a lot of confusion about the different limitations, permissions, boundaries when it comes to a service animal, a therapy animal, an emotional support animal, and what they can do, cannot do, where they can go and where they cannot go. So that's why I've asked Miranda to join us as kind of our in-house expert. You may have noticed she has an animal with her today, and she's very knowledgeable in terms of, the background and the ask. And I just want to preface this again. I'm starting here as a respect to all of you and to respect the process, but the department itself has not made up a decision as to whether we're going to do this. I wanted to discuss it with all of you first to get your support and comfort, to then take it back to my management team, my clinic director, and say, okay, listen, do we want to sink our teeth into this? Is this something we want to support our clinicians in offering to clients when appropriate and when indicated, and what's the process that we want to create? So with that, Miranda has a really nice handout that she created, and I'm sorry for not getting this to you sooner. That really nicely explains what the do's and don'ts are when it comes to these different categories. Do you want to? Oh, sorry. Everybody have one?
And the category we're focused on is the service dog, right?
No, emotional support.
Because here it says service animal.
So, yes, so that would be a typo. We're focusing solely on emotional support animals today. We would like to ask for the ability to support our clients in living with emotional support animals, as Dan said, when it is clinically indicated. So this would be granting clients the right or supporting their right to live with animals, domesticated animals, only to live with them when that animal is a support to their well-being, when they have a positive relationship with that animal, and they themselves have a disability which impacts their ability to function, and the presence of the animal lessens the symptoms that they experience.
So this animal is not an animal that's trained. It's not an animal that has the right to be in public. You are not giving that animal the right to be in public. The only thing that you're doing is you are guaranteeing that, yes, I acknowledge that this person is disabled as meeting the criteria in New York State, and that they have a relationship with this animal, and the presence of this animal in and of itself mitigates the symptoms of their illness, whether it's physical or mental, and allows them to function better.
Any questions? Basically, the way I see this, and Miranda's done a lot to even help me, and she's given a presentation to all the staff in general about these different categories, because there's a lot of mystery and misunderstanding about this. But we would be, in a sense, putting clinical validation to what the client is communicating to us in terms of the value that this animal serves to them as an emotional comfort, and how it resonates in a positive way in regard to their disability. And in this case, with an emotional support animal, it does, as you see on the form, allow them to be considered for housing in an instance where a landlord may not accept quote unquote normal pet or animal.
The issue becomes, it's not really an option. If somebody looks at an apartment, and I mean, this is, I think, where the rub is going to be, and it's going to be my rub
As a landlord.
And I don't have a problem with dogs. I have pets and et cetera, but people abuse that, right? So they come to rent from me and they say, well, this is, an emotional support dog. Now I realize you're saying that we would have a piece of paper or a diagnosis or something from mental health that would say, well, this is validated. But what ends up happening as a reality here is that that person may not be qualified, period. But then that individual says, well, he's not allowing me to stay in the apartment because I have a pet, because he has a no pet policy. And it may be that that person's just not qualified financially or for a bevy of other reasons, and that gets thrown at you pretty harshly. So again, I'm not saying that the group won't support this. I'm not saying I won't, but I have real experience with this and how that happens. And then people scream at you. It happens all the time. It's manipulated all the time. I also own restaurants, so it's manipulated all the time. People abuse it. People don't, not the people that need it, unfortunately. It's the individuals that just want to bring their dog in because they don't want to leave him in the car or have whatever, a Belgian Malinois. I want to live in a small apartment that I have. It's abused all the time. And as far as flights go, it's only service dogs because I fly a lot that are allowed on planes.
So the Air Carrier Act was amended in 2021. So emotional support animals are treated as pets. So this would have no impact on air travel. Well, I do appreciate what you're saying. It is important that we don't pull the support that we give to people with disabilities and the impacts that we are providing on upholding their rights based on the exploitation that other people are engaging in. And I can, I did bring along the, HUD's guidelines of what the, rights for landlords are. So while you are required to allow somebody to live with their emotional support animal if they meet the criteria as an emotional support animal. That doesn't mean that they are no longer responsible for that animal's behavior. So while you are not that person, an emotional support animal is not specially trained. So you're not guaranteeing that the animal won't destroy property or won't be aggressive, but the handler is responsible for any damage that is done.
And how do you enforce that?
The law dictates that you have as a landlord, you have the right to charge the person any damage that is made. You have the right to either charge in a fine or to pull it out of their safety deposit. And if you have concerns based on the animal's behavior. Like if a person comes in and says, this is my emotional support animal, but, you know, perhaps this person or the animal is, you know, lunging and biting at you. So an emotional support animal is not guaranteed to be specially trained to be friendly. But if there is concern that it is an animal that is getting into altercations or poses a risk to other tenants, you do have the right to decline them for that reason. And you would be supported by the law in doing that.
I understand that, but do you realize how difficult it is to access the law for any of that?
I
It's
think
very difficult. So I guess let me just, I'm sorry, one more point I want to make and then everybody else. In recent years, and again, you pointed out that I am a landlord, but that's not what I do for my main source of income. But landlords' rights over the last X amount of years has been diminished tremendously. And I think as a county, we should be looking at both landlords as well as individuals that potentially may need this. And by putting a stamp on it through the county, it sort of diminishes again some more rights that landlords have. So for me, I want to look at it from both sides. Service dogs are very different because the service dog is trained like you have there. But this is widely overused and unfortunately, so for me, I just think it's opening up a can of worms. And I also think that then the county is saying, well, if you go through our, you know, and you get the letter, it's okay to do this, but I guess
that leads to asking Dan or our guest, what would your office require in order to issue validation of somebody having an emotional support dog? I'm not sure what criteria you would ask of a client in order to be able to do that.
Right.
So I assume you've thought about that a little bit, but maybe not ironed it out.
We've thought about it a little bit, but we've been very cognizant to not get ahead of ourselves because we felt this was the place to start. So what I can say is, yes, there would be an assessment process. It would rely heavily on that clinician who presumably has a relationship with the person. We may put a stipulation in that there has to be some tenure with the department with that individual that is making the request so that we know who that person is. We know their level of sincerity. We know their level of need around this animal and this request to identify the animal as a positive influence on their emotional well-being. So we would do that. We could have some sort of a review. We would have to get the support of the therapist working directly with the individual. The clinic would have to sign off on it. And a third layer might be myself as the department head. We would not be doing these, recklessly. There are always going to be bad apples that ruin it for the bunch, as they say. I'm very aware of what your concerns are, Supervisor Logoni, because again, as I just disclosed, I'm a landlord myself, and people exploit things. That's very unfortunate. What we're asking for, and again, no hard feelings if you feel this isn't appropriate for the county to support, but this is another way that on a case-by-case basis, we can lend support to an individual who is already struggling with some significant challenges. If they identify that a pet, cat, dog, whatever, I think there's some limitations as to what can be categorized as an emotional support. It can't be a caterpillar or a butterfly, right? But you understand. That can resonate in such a powerful way. So to legitimize it with some sort of a document, which we are able under the law to provide as clinicians, as social workers, nurses, et cetera, as healthcare providers, we can do that. I'm asking for that consideration. And again, as I said, I'm not guaranteeing that we're going to do this departmentally because those conversations that you're touching on need to occur. The optics of this are relevant. We don't want to bring negative attention to our department. We don't want to further stigmatize people with mental health issues to now be identified as, manipulators and exploiters of service animals, law and legislation. They have a hard enough time, people with behavioral health issues. So,
I certainly can understand that, emotional support animals, dogs, cats could certainly be a benefit to a lot of people. I do hear Rob's concerns and I understand that as well too. And I do worry about, landlord rights in general, and I think that our state legislature is about to attack them again soon, so I have those concerns. If you were to move ahead with this, is there a way that you could respect? I mean, if you had an applicant that said, I'd like to have an emotional support dog, is it something you could reach out and find out what the homeowner, where they live, they had to be the landlord or whatever, has an input on it? And I don't know what the law allows you to do.
The law doesn't, it's actually, you correct me if I'm wrong, but I've read through the ADA. You can't ask somebody for any documentation. So they would be offering a piece of,
Yeah.
in all of these situations, you can't ask for any documentation as an individual in a restaurant or in a, but.
And that's actually, I don't mean to.
No, I just said, if I'm incorrect, please correct me, but go ahead.
For a service animal, it's illegal to ask for documentation.
Right.
For an emotional support animal, you are allowed to ask for documentation. As a landlord, in a restaurant, there would be no reason to ask for documentation because an emotional support animal is not
Right.
allowed there. But often there's confusion. People don't understand.
Well, people come in and they say, this is my therapy dog. And then I say, well, it's not allowed. Well, it's a service dog. And so what are you
And
gonna do?
hosts
What you know,
don't
right,
necessarily understand,
Right.
always understand what their rights are. So-
That's the biggest problem that we're facing.
Correct.
Look at what's going on in this group as we've tried to tackle this conversation from when it started in January. There's an ambiguity, a nebulousness that nobody understands. So some people, just withdraw and don't ask. So then, people feel entitled to bring that animal everywhere because people, you can't ask, you can't say anything. And then bad things happen. And then some people, try to, restrict when they shouldn't, and then there's conflict. So it's really, look.
I have a different question. I'm sorry, Matt, go
Oh,
ahead.
go ahead.
So my question is there a hold harmless agreement for our staff if we knowingly put these dogs in the community and we know they're untrained? We don't know if they're aggressive or, poorly behaved in any other context other than with their owner. Are we, as a county and as an employee, held harmless associated with any injury?
Somebody that's bitten.
Yeah, and that happened recently when I was in a restaurant. Somebody's dog jumped down, ran across the floor, and tried to grab a piece of food from a child. The child was bitten, and it was a service animal, but it wasn't a service animal. It was an emotional support animal. So where would we be in that
scenario, I don't
process?
see how we could be, because the letter that we're giving does not allow the animal to go into a
But
restaurant.
again, there's this lack of clarity about which animals can go in restaurants and which
But
ones can't.
we're just supporting an emotional support animal.
To live with people.
So if they weren't in a restaurant, say if they were someplace
They
else,
bit the landlord.
right, are we held harmless?
Can I ask a question?
Sure.
As I understand it, you couldn't be doing anything more than acknowledging that the support animal or the,
Emotional support animal.
the emotional support animal or the service dog is indicated,
That's right.
right? You're not checking the animal.
No, we're not speaking to its lack of or
You might not ever
Not
see
aggressive.
the animal,
correct.
right? So you're not really
We're-
speaking.
It would be unusual for us to meet the animal because the animal does not have the right to come into public, and so they wouldn't have the right to do for us.
All we're saying is the person has a diagnosis, in this case, a disability, in our case, a behavioral health type disability that would be positively impacted by them having an emotional support animal. That's it. That's
In
what,
their,
in their home.
I believe in the January meeting, we had asked you to contact the county attorney's office.
Yes, there's been communication. I wanted Miranda to come and introduce herself, give this piece of paper, field questions. If we'd like to have, you wanted them to be here. I didn't invite them to be here. I can invite them next time if you'd like to further the conversation. We don't have to just.
Well, all right, we can have the meeting offline if we have.
Okay,
well, I'd like to just put forth, we're not asking for everybody to come in, who comes in asking for an emotional support animal letter to get an emotional support animal letter. We're asking essentially for you to trust our clinical discretion, right? So if you, I know you don't know me at all, but you have a relationship with Dan. So we're asking if there's a therapist and a clinical supervisor and a clinical director and Dan who all agree that this is a specific case by case. In this case, there's this person who meets the criteria, who we believe is appropriate, who won't be abusing this. Can we write them a letter? Right? So
I have another question. What about if it's a breed specific, like a pit bull or a Rottweiler, where my insurance won't allow me to put those tenants in my building?
Don't know.
Well, I think these are all questions that we'll have to have answered with the attorney's office.
Yeah, a deeper dive. We need more.
And I'm okay with that. I understand the sensitivity and the desire to understand the exposure and the liability, the potential liability. But, and I appreciate you hearing us today and what we're trying to accomplish by further supporting and offering some, lack of a better word, and another layer of support to these individuals that are people with a disability and are trying to get well.
But where would these, just one more question, where would these animals be if they can't be in public places, stores, restaurants, libraries, airplanes, trains? Why do they need permission?
They live with
Why do they
regulators,
need? Right.
To get an apartment.
It's for the no pets policy.
Oh,
I think
that's
the
really,
biggest
that's the
row
issue
of
that's being
importance
addressed, the
here.
apartment? Okay.
Yeah.
Yeah,
Actually,
okay.
no pets
for people who
policy,
are struggling to
but-
find
Right.
housing
Okay.
or keep housing.
Okay.
And personally, as a landlord, I mean, I usually put in a lease that there's no pets, but if you get to know the homeowner, the renter, and you know them and they like him and they have a respectful dog and they're gonna be good, then fine, have a pet, but.
I'm the same way, yeah.
Thank you very much. I will communicate
Give them
with regard to the county attorney and we'll get together. Would you prefer to do it offline, Matt, rather than here?
Set up a separate meeting.
Okay, thank you very much. Appreciate everybody's.
Terrific, thank you. Thank you very much.
The worst one I ever had was I had a sheriff there. They wanted to have his own.
Anything from the committee?
Oh, you
Just
missed,
for the evening.
I know, I was gonna make a special
You
drum
won't forget
roll
that,
here.
What does he have? Kevin, do you have anything to talk about or no?
Ladies and gentlemen, Kevin McDonald, please come approach the bench.
Do I have to?
Yes, you do.
One more time.
One more time. It's kind of a bittersweet moment for me. It's been a long time. It's been a long road. As some of you know, I know the chairman knows, Chairman Morrell. I spent my first 27 years, I think it was, in probation. Took 15 years off and then I come back for a few months, which turned into 9 years. But it's been a good 9 years. I think a lot of it is due to the support that I've gotten from this committee, from you folks. So, it's kind of a bittersweet moment to be leaving, but time's time. And I did.
We're not sure which career you're coming back for next, Phil. That's what we don't know.
I don't know. In between, I drove a school bus, so Mike Johnson's probably going to be reaching out to me, but not going to go there. So now, like I said, I'm going to play a lot of golf. My wife just got a puppy. I'm going to be
And multiple part dog.
I'm going to bring this home to her. I'm probably going to need therapy.
Right.
But I brought with me Nina Benvenuto, who's going to be filling in for me after I leave. I think many of you folks have already met her through the interview process. So I think it'll be a smooth transition. And again, thank you for your support.
Thank you for your service.
Thank you. Thank you for the support.
Welcome, Nina.
welcome you.
Welcome.
I do have one good thing to announce. Just last week, I got a phone call, thank you, from Treasurer Keeler from the Bank of Greene County, looking to donate $10,000 to our Senior Stars program, okay, to help the seniors. A lot of them, primarily for minor home repairs. And we do get a lot of calls from people that something went wrong with their plumbing, they can't afford to fix it, and now we'll have a special stipend. Hopefully our department will be getting the money within the next month or two. So,
Congrats.
Very good.
Well, thank you, Kevin, and thank you, attending the OFA meetings. You did a marvelous job with everything, so.
Thank you, thank you.
Thank you.
Yes, thank you much, Kevin.
So we're gonna move down shortly to Kevin's cake.
Oh, that's my cake?
Yes. As a matter of protocol, is there any comment from the public? That being said, I'll ask for a motion to adjourn.
Motion to adjourn.
I'll move second.
All in favor?
Aye.
Thank you, everyone.
Welcome, everybody. I'd like to call Public Safety Committee meeting to order for March. We're going to run through the agenda before we have the fire services system review. We're going to do that at the end. There's not a heavy agenda, so I think it'd be better if we do it that way. So first department up is the Public Defender's Office. Mr. Zoni.
Good afternoon, everyone.
Good afternoon.
Hello.
I have, just one general resolution request this evening. Move it.
Second.
Second.
All right. All in favor?
Aye.
Opposed? So carried. Thank you. Emergency management.
We submitted our activity for the month and our annual report. Glad to answer any questions to that. Also, as I'm sure everybody's aware, April 8th is a total solar eclipse. New York State will be providing glasses, which I'm not sure how it's going to be in our area, probably in the Capital District area. But you'll be able to get free glasses if you want. They'll be posting where you can go to get them. As far as I can tell, in our county, it's going to be like dusk if it happens. And that's if it's not cloudy. It'll be worse if it's cloudy. 95%, depending on where you are. It doesn't seem like a lot of events, and everybody's a bit aware of it. So, we've offered to put a countywide plan together, but I don't think it's really needed at this point. There's not going to be. Some of the schools are out, some of them, if not all of them. And I think it's probably going to be like a 4th of July weekend during the week. But we've been talking to the sheriff and some of the other agencies. If we need to, we'll do more.
I did look at the places to get glasses. They're kind of far away. Is there any way you could reach out to New York State and see if you can get any as county emergency management, so you can get some?
They had one countywide or statewide call, and there's another one Monday, so we'll ask.
That'd be great.
Yeah.
Thanks.
At least they should have it.
Thank you.
Thank you.
Yeah.
District Attorney.
Hi,
how are you?
How are you?
So I have two personnel resolutions today. The first is for a part-time ADA. It's moving a full-time ADA into a part-time spot. So it's actually cost savings.
Move it.
Second.
All in favor?
Aye.
Opposed? So carried.
And the second is a personnel resolution for a community liaison position. This is a position that's already created. We're filling a position that was empty because of resignation.
Move it.
Second.
All in favor?
Aye.
Opposed? So carried.
And we discussed this briefly in an earlier meeting, but I just wanted to dispel rumors that have seemed to have taken off in the community, or I don't know where they came from. Under no condition, under no circumstances am I planning to leave the office of the district attorney. I am in this job because I fought hard for it. I won an election. I am proud to have won that election, and I am proud to be serving the people of Columbia County as district attorney, and I intend to do that as long as I can.
Thank you.
Just a quick check-in. Staffing. I know that we've been doing a lot of resolutions. Are you almost at full staffing?
We're basically full. I think we have the budgetary space for another attorney. We don't have the physical space actually right now to put them. So that's something we'll be looking at going forward, but essentially we're fully staffed, and I'm really happy with the crew we have.
Great work.
Good. Any other questions? Thank you.
Thank you very much.
Thanks. Mr. Borton, Conflict Defender.
Hi, everybody.
Hi.
Welcome.
Thank you.
Welcome.
So there's three resolutions. One is dealing with the local law, forming the establishing a conflict defender's office. And then there's two, there's one personnel, filling for a confidential administrative position, and also a resolution for contracting with software company for proprietary case management system.
Okay, need a motion on the, local law.
Move it.
Second.
All in favor?
Aye.
Opposed? So carried. In reference to case management system for proprietary confidential information, maintenance and access, I need a motion. Second,
Second.
all in favor?
Aye.
Opposed? So carried. And the,
I think if you went in the other order, Kelly. He just did this one now.
Oh, here it is.
No, it's two.
I may have. Well, I only have two here though that I can see.
Contract with software company?
I
He
did
just
that.
did that one.
And I
He
did,
did
the-
local law, then he did the
The administrator.
case management, now it's the position.
It'd be the confidential.
yeah, right.
I'll move it.
Second,
Second.
all in favor?
Aye.
Opposed? So carried.
Thank you very much.
Thank you. Probation.
Good afternoon, everybody.
How are you?
Doing well.
I did. Oh, that's right. Thank you.
I just wanted to submit our annual report. In a nutshell, nothing drastic has really happened when it comes to the caseloads. They've been pretty steady. I don't, and especially with the courts and the transition, I don't expect us to get a flux of cases moving forward. Our pretrial release is taken off, obviously with bail reform. We're trying to make sure that people are getting back to court. That's been working pretty well. And the family court everything has been going pretty steady. So at this time, I'm pretty happy, with our direction with the caseload. We are down a couple of staff, but I don't think there's any need for a knee-jerk reaction. Nothing's gonna sneak up on us that we can't handle. So if you guys, I know a lot of people don't know exactly what we do, but if you have any questions, please feel free to reach out to me. Even during the course of the day, whatever, if something just comes up, be happy to help out. So
Typically, we accept the annual report and hold it over for a month, so we have time to review it, and then we can approve it at the next meeting.
I'll be here.
Any questions? Thank you.
Thank you.
EMS?
All right, how we doing, gang? Okay, I have, one resolution request, that is to revise Dr. Stippa's, contract with the county to allow him to do firefighter physicals at the training center at the rate of $100 per physical, and the county to incur the cost of the director's professional liability. The professional liability insurance, we have it in the budget already. Talked to Jim. That had to do with some of the leftover funding due to the new activity at the jail, that we don't need that liability coverage there. And this, as you know, we talked about this before between the fire coordinator's office and my office. We're trying to get back to offer free physicals for our fire departments again, as Columbia Memorial once did years ago, pre-COVID. This way, the medical director's salary per physical will be paid out of the workers' comp line item budget that we normally pay back to firefighters at a rate of 65 hours per physical. Physical rates now are ranging between 165 on up, and so it'll be a great savings overall for the fire companies as well.
So PJ, just to clarify, the county would pay both the $100 per physical for any volunteer firefighter in the county that needed it, plus the liability insurance?
Yes.
Awesome.
Yeah.
And we'll obviously advertise that to the local
Yes.
companies.
For context, is it pretty common for our firefighters to have insurance that like doesn't cover physicals?
They don't have insurance to cover physicals. Usually what happens is if they contract with an outside outfit to do the physicals, they pay the full shot, and then we as a county reimburse them $65 a person.
I'll move it.
Second.
All in favor?
Aye.
Opposed? So carried. Any other questions?
The other thing is just an executive budget summary. Governor Hochul's budget this year, I know we've been talking about this, but in all the years I've been doing EMS, I've never seen so much activity, involved in recognizing EMS. Lord knows where it's gonna go, between the two houses and the governor's, office themselves, but there are a lot of proposals out there. I just want to identify a couple. One big major proposal is to make EMS an essential service. Those of you that know, it has never been an essential service, so that'd be a big step as far as EMS goes. The other step would be, obviously, they are together with that. If it's made an essential service, they're proposing to allow counties to create the separate districts to support financially the service in itself, which is another big step. The other one would be, they're actually trying to come back and say, in New York State, they want the counties to be responsible to have a plan for EMS. So quite frankly, we've been kind of ahead of that game. We created this several years ago, so we are ahead of that, and hopefully that won't pertain to us. But the special districts and creating essential service are really important. The other proposal that's in place or being asked for is to allow EMS to deliver patients to places other than the emergency room, such as an urgent center, and actually get reimbursed for it. Because it is now, as it is now, the only reimbursement through insurance coverage would be if they deliver the patient to the emergency room. That together with community paramedicine, which would allow medics to treat patients in place at home and get reimbursed for it. So again, stay tuned. Next month or two, I'll come back and say, well, they didn't pass any of that. You know, but let's see where it goes.
Great. Thanks. Any other questions? Thank you, PJ. Fire?
I was gonna say, do you want to call 911 first?
Yep. 911?
I don't have agenda tonight, but I did submit our agency data for the month and any questions.
Any questions? Thank you. Okay. Fire, so office activity year to date, 9 emergency responses, training facility. Is he here? Oh, where?
I'm kind of here.
Oh, go ahead. I didn't realize you were on.
No, it's okay. You can just see our office activity and the classroom stuff. We're starting to gear up. Our classrooms are running 4 days a week now, so we're starting to gear up for busy training again. The next up thing there was a request to waive the training facility usage fees for FASNY, who's doing a free program for the volunteer firefighters in the county, and for New York State DOT, who is they're doing a confined space rescue for their staff so that they can supplement response for our county.
I'll make a motion to waive those fees.
Second? Second. All in favor?
Aye.
Opposed?
Thank you.
Carried.
The next thing up is a presentation of the countywide fire department study done by Fitch and Associates, and I believe Bruce Mueller is there from Fitch, and he's going to take and run over the long-awaited study from the fire departments.
Thank you, George. Come on up, sir. Introduce yourself.
Presentation. Yeah, let me get the presentation up here.
You with the PDF one?
Yeah.
Where would you like them?
Maybe over here, yeah, so everybody can see. So we'll have the presentation, and if there's any questions, obviously raise your hand and we'll give ample opportunity to ask questions, okay?
Have to get it so I can share it.
While we're waiting, Supervisor Ligonia, we're going to be rolling this out to the fire chiefs too at the battalion meetings in April. So they can input in it as well. So.
Thank you.
Folks, there are some chairs available, I believe. There's a chair down here. Are you all here for the presentation? Everyone's here? Have a seat. There's one here, over here. So you don't have to stand, because I think it's gonna take a little while. Okay, Mitch, ready when you are. Just tell me when you wanna.
Okay. Are you all set?
Yeah.
Okay. Good evening, Chair, committee members, thank you, and audience, thank you for allowing Fitch to come and present this review of fire service within the county. My name is Bruce Mueller. I'm a senior consultant with Fitch and Associates. Excuse me, got a little bit of a sore throat, so forgive me for that. And what I'm going to do is my understanding is the committee, part of the Board of Supervisors, has gotten the report. I've seen copies that some chiefs have and stuff. So I'm just going to stay focused. This is a PowerPoint. I want to stay focused on the high level issues that are kind of relevant to where the options that can be considered by all the stakeholders. So I'll stay to that, but I'm happy, as you indicated, to ask any questions or answer any questions at the end. Thank you. So what we were asked to do was to look at the county's fire services overall, including oversight and coordination among the 31 agencies. We pride ourselves on being a very data-driven firm, so a lot of this is based on the data, but of course, sometimes data doesn't tell the full story, so you've got to sit there and talk to stakeholders. I was not involved in that process. Several other of our consultants were. Chief Steve Knight, Todd Sheridan were here and spent some time, I think a couple days, with various chiefs and stuff when they were on site earlier. And they shared all of that with me, which has been incorporated. So the next slide. So I'm just going to lay the groundwork. One of the things that we typically do not do is make a specific recommendation, do X, right? These are policy choices. At the end of the day, the community, the county, agencies involved are going to have to decide where they want to go. So we have a series of options. Kind of see these are the high level. I'm going to go into them at the end once we kind of have some background information to go with that. Anywhere from option 0, which is just keep status quo, versus kind of an increasing building on one another to bring a little bit more coordination, a little bit more structure to the existing system, and to capture opportunities to hopefully improve the system some. Next one, if we could, Kelly, thank you. So as I indicated, a lot of the data, the bulk of the data that we used came from the county's 911 system. Thank you. We had 4 years of data that we used. There's a full data report in the back of what you received. There was a full data report. Again, I won't spend too much time on that, but we looked at the most recent full calendar year of the data that we had, which was January of 2022 through December of 2022. So we looked at that to kind of look at the system. And during that 4 year, or during 2022, there were 15,839 records that we saw in the CAD system. I'll address one thing right up front. Many times we're asked, why didn't we use the fire reports that the agencies all have to file when they do a response? And the term in the industry is called NFIRS, the National Fire Incident Reporting System. And they'll fill out a report, it goes to the state, the state then sends it to the federal government. The problem with using that is that's looking back at what happened. When you're looking to design a fire system, a fire and EMS system, you have to respond to what you're being told, what 911 initially gets. If somebody tells you the house is on fire, you respond to a structure fire. When you get there and you find out it's nothing more than maybe a pot on the stove, whatever, a small cooking, the NFIRS report would reflect that what they found. But you have to respond to what you were told. So we always look at the CAD data as the best source to understand what we have to respond to, when you have to do it, and how that occurs. So that's why we use that. Next one, if we could, Kelly. I know people in this room certainly know this, certainly much more than I. We looked at population. The big question we wanted to answer here is there something happening in the countywide, that's going to result in increased demand in the future going forward? We looked at population projections. There's nothing in the data that shows that there's massive growth that's going to occur. There's a lot of new development coming in. So essentially in the short and the near and midterm, you can expect that the demand for services for fire are going to be relatively the same, maybe even fluctuate down a little bit. Next one, if we could. So as I indicated, the current and projected population, and that all came from the Census Bureau, we're not expected to increase in the near or short term. So let's talk about the current system briefly. Obviously, the fire coordinator's office, George is on the phone along with the staff here as well. Kelly, the next one if we could. So the coordinator's office obviously has the coordinator, deputy coordinators, and then training instructors that really take advantage in a very positive way to sit there and provide certain levels of training. Obviously, they're all listed up there on the screen. That opportunity, rather than each agency trying to do that on their own, would be very inefficient, very problematic, especially in light of recruitment and retention issues. So they do that now. As you'll see, as I build this story a little bit here, there are opportunities to the degree the stakeholders want to allow the county to kind of expand that role a little bit. One of the other things that we did, as I indicated, while we're very data-driven, on the next slide, if we could come, is the stakeholder qualitative feedback. This is what the perceptions were. There were kind of three major themes that came out to the team that was here: recruitment and retention of volunteers. I will tell you, this is a problem throughout the nation, full stop, period. It is, every community is struggling with it. Many of the factors are all the same. One of the things that kind of jumped out to me were the last two bullet points under recruitment and retention, that you've got more senior members, people that have spent quite a few years serving their community, participating in volunteering their time and effort. But as they get older, it's more challenging for them to sit there and do that. So some of them are starting to leave due to age, and agencies are struggling to reduce them with younger individuals that want to do it. And of course, very typical, again, actually 50%. I'm pretty impressed with that number. I will tell you, there are many places across the nation where, and we've done studies in other similar type counties, very rural in nature and stuff. When we look at them, to have 50% kind of active or really engaged is actually a pretty positive number. The other thing that I want to spend a few moments on is the consolidation term. That term came up. It was put out there by our team to kind of ask that question. I want to be careful. I want to be very clear when that term is used in the context of this. People hear consolidation, they kind of take it to the furthest. We're not talking about that. Consolidation is not well defined in people's minds. And what we talk about, as we're going to see when we get to the options, is varying levels of opportunities to have a more coordinated, centralized, or facilitated process where all the agencies work together. That's going to have to ultimately be decided by the key stakeholders, and ultimately not just obviously the recommendation of this committee, but the Board of Supervisors, all of the locally elected officials that are, need to have those services delivered. So we'll talk about those in a second. Next one, if we could. Well, wrong way.
Sorry.
That's all right. So it was kind of interesting because, and I even heard it with a few people out in the hallway, there's kind of a recognition among a number of the participants, fair number, that some changes need to occur. But once you get past that, then it all starts, everybody's got a different opinion. What should it be? How far do we go? What has to happen? The major theme, I will tell you, not just here, but in other ones, has to do with the continuation of the respect and honor for those agencies and for those individuals that have served the community. And I will look at this committee particularly, and then the Board of Supervisors overall. That's a very delicate balancing act. There's no way anybody from the outside can come in and tell you the best way to do it. It's really going to depend on the leadership in this room. Others throughout the community, they're going to say, look, we need to balance that a little bit. So I just keep that in the back of the mind as you have these discussions once we're done tonight and even in the future. Next one, please. So let's talk about the demand. I want to, one of the questions that kind of came up to me had to do with this issue. So I'm going to give you several numbers tonight, and I'll try not to bore you too much with it, but it has to do with how we count, right? So when we look at the CAD data, we talk about a call, an incident, an event. That's one thing that happened. Somebody's house was on fire. There was a major vehicle crash, right? One event. And then within that, you have responses. It may take 1 unit to respond. It may take 5 minutes to respond. We may spend 15 minutes on the call. We may spend 2 hours. We may have multiple departments, multiple volunteer companies that need to respond. So we'll distinguish that. So as I go through this, most of what I'm going to talk about today is 2022, the number of incidents. It's always important just to look at, this one's kind of a throwaway. We look at when the incidents occurred. There were 2004 incidents in 2022, unique incidents and events. Something happened, not responses, something happened. 2004, if I look at by month, if I look at by day, fairly uniform, that's typical. The next slide, if we could. What is not typical, and to draw your attention to, is this. This is by hour of day. As you can see, 3 o'clock in the morning is the low period of time for call activity. And then, of course, when you get around 7 or 8 in the morning, as people get up and are moving, it goes up. And in the middle of the afternoon, look at the 911 coordinator here, you know, that's when the maximum call volume is. If you look at that and add it up, at the next slide we could, that almost 70% of your calls occur in 12 hours. So 70% of the calls. And the challenge really is with the volunteers, right? Because I'm assuming most of the volunteers, as in most communities, work during the daytime, especially Monday through Friday. So when you have calls, the highest demand is when those people are often not available, right? Another challenge to the recruitment retention. So we did take a look at that. We also looked at not just when they occur, but what were they? This was interesting. So I sorted these by the count. So alarm, activated alarms, and then wire transformers. Those 2 categories alone represent almost 2/3 of the calls that occurred in the year. But you've got a number of fires, you know, brush fires and vehicle fires and structure fires, all about 1 a week in each of those categories. So there is fire activity, but the bulk of what are being asked to respond to for fire companies is those first 2 categories. Next one, Phil. So this is where we start getting a little bit more. So I mentioned there were 2004 unique events, right? 911 got a call or multiple calls. Something happened. Then units were dispatched. We look at what the CAD records reflect on that. That's the data source we use. And what you see is for each of the companies, each of the departments, there were 3,792 times that those agencies were asked. If there were only 2004 incidents, that says there were about 1,700 times, almost 1,800 times, that you needed more than one company to respond, right? And if we look at the number of units that went, the number of units was 27,882. That works out to 7.35 dispatches per incident. Now, sometimes that's a little deceiving. I will tell you, we did make note of it. Chief officers, particularly people responding from home, right? So if you have chief officers, that's typical, right? They're going to get in their car, they're going to get on the radio, they're going to say they're responding. That doesn't necessarily mean they were all engine companies, or all brush trucks, or all tankers, tenders. But still, at that number, the next one if we can, especially with the first 2 alarm types representing 2/3 of the calls, activated fire alarms and wires, transformers, to have 7.35 units, I'll just tell you on a comparative basis for very similarly situated counties throughout the nation, that's a bit high. And it appears that there is an opportunity to at least look at that, to say, why do we have that many going? Is there something in the call flow process or the way that units are being alerted, or who wants to go? So there's an opportunity there. If we can stay on that for just a second, Kelly, that's right. The challenge is this, which I know the chiefs here know. When you ask people to volunteer, right? They don't want to go through the training. They don't want to have the annual physicals. They don't want to do this. They don't want to do that. And then the pager never goes off, right? So again, another challenge point, right? A little bit of a balancing piece here. But still, that number is probably higher than we would expect to see. It's certainly higher than we see in other comparable counties. So there may be an opportunity there. The next slide I'm going to show you, really, this comes from the U.S. Fire Administration. I just did something recently they did. The current U.S. Fire Administrator had her team put this together, drawing data. It really is, it's a home fire, so it's dealing with residential properties, vulnerability assessment. It takes a lot of Census Bureau data. It takes other stuff from the Center for Disease Control Social Vulnerability Index, and it looks at actual fire fatalities, not injuries, but fatalities. On the bottom, underneath the map there, showing where Columbia County is, those red bars reflect 5 reported fire deaths. So that was what was reported up through that system I talked about, the NIFRS reports. But overall, the county's risk in your residential properties is low based on that assessment, right? So sometimes you will find more rural counties that have much poorer ratings, that they're much higher. The risk is, moderate or even high. but not here in Columbia County. So that's a positive indicator. Next one, if we could, Kelly, I think I'm just repeating that. It's found low. That's their assessment tool. Again, it's somewhat new and there's some methodological issues. Who cares? That's what they said. So I shared it with you. Okay, next one. So I'm going to talk about the call flow. This actually shows primary, secondary. I'm going to talk about performance here now in a moment and how it goes. And there was some surprising information in there, actually very positive. An event occurs on the far left, right? So we have timestamps. When something happens, the 911 office will know this one when something happens. And then there's between several of those timestamps, you look at that interval. So the orange one, call received at the PSAP is the call received at the primary PSAP. You guys are primary, right? If I remember my notes. From that time, they need to process the call. They need to do two things. Where? Sometimes it's much more difficult in an age where 70 to 80% of the calls are cell phones, right? You've got to geo-validate it and know exactly where you're going and what, where and what. So until the units are dispatched. That turnout interval, I'm going to talk about it's from the time the call was received, the earliest timestamp in the CAD, until the very first unit was dispatched. That's how we calculate that. And then from the first unit dispatched until somebody got on scene. It doesn't have to be the same unit. First unit dispatched to the first unit's on scene. And that's the travel time. And then of course they're on scene, etc. Response time is we just look at from the orange bar, the call received until the unit's on scene. So we calculate every one of those individually. I think this committee on the next one, if we could, Kelly, this committee is probably aware, but for the people in the room, I think in the discussion you probably had earlier with EMS and with PJ talking about 90th percentile. So in evaluating or designing public safety systems, fire and EMS specifically, if you're going to set a goal, what are we shooting for? What's the target? What kind of level of service do we want? You want to do it generally using, and the industry recommendations are to do it at the 90th percentile. That means 90 times out of 100, you're going to make the mark. Everybody talks average, and I would be very candid. In a public forum and in your reports, I would always report average because trying to have a discussion on 90th percentile gets very challenging. But for the policymakers, understanding you want to do the 90th percentile, because otherwise it's a coin toss, right? Maybe we'll get there, maybe we won't. You know, it's 8 minutes for cardiac, whatever. Maybe we get there, maybe we don't. So you do it 90 times out of 100. So I'll be talking about the average and the 90th here on the next slide. When we look at the performance here, on the next slide, Kelly. So focus on the line that says average, and then we'll come down a couple on 90th percentile. This I pulled out of the report, and I just did a bunch of descriptive statistics on it that are only interesting to geeks, of which I'm one. So that's why I put them in there. Call processing, 1 minute and 30 seconds. That aligns well with what our average. Call processing time 130. Turnout time 2 minutes and 54 seconds. I'll tell you for a volunteer county, that's actually a very good number. Now, again, I recognize it may be somebody with a radio, you know, from home. I'm responding, right? They still have to get a truck, whatever. But look at the travel time: 5 minutes and 4 seconds, and then 902 overall average. And then if you drop to the 90th percentile, 3 minutes call processing, turnout 6, travel time 10 minutes. That's quite good. In this county, as rural as you are, as spread out as you are, that 10 minutes, actually think about how far you can travel if you had to leave now, how far you'd get in 10 minutes if you had to go somewhere, and then the overall 16 minutes. So those numbers were actually better than I anticipated, looking at the geography, looking at everything else. I'm going to focus on the 10 minutes for a second, the travel time. When we get to some modeling and I talk through some of the same things you probably saw, PJ, I'm trying to remember, but I think the EMS report had similar, right, the mapping. Yeah, so we'll use 10 minutes as kind of, that's where you're at today. That's where you're at today. So unless people are showing up all the time and with your elected bodies in the towns or here with pitchforks and torches, that's how I frame it. Saying we're unhappy, that took too long, or it was too whatever, but if they're not, then you can go with the assumption that the current level of performance is at least meeting some expectations within the community. So the 10 minutes at the 90th, we'll use that here in a second. The next one, if we could, Kelly. This is, again, in the full data report and in the executive summary, again, just looked at average response time, but on the right side, the average time on task is also something to look at. How long does it take? When you get an activated fire alarm, the very top line there on the far right column, on average, from the time the call is received until the last unit clears. That's what that is. 19 minutes and 50 seconds is what that is on average, not 90, but average. If you go to structure fires, where structure fires down there about mid-level, you see that a structure fire, thanks, Howard. A structure fire, you're spending 2 hours and 20 minutes on that. Intuitively makes sense, right? So when we look at systems and how many resources you need, if companies are going to be tied up for an extremely long time, if you had a high number of structure fires and they're always tied up on that, who's going to take the next call? You don't really have that problem at the call volume. If you were growing it was something we would need to look at and we would point out. I don't think you've got that, but it's something just in the back of your mind to kind of recall. If all of a sudden we have multiple calls, concurrency is what we call it. You have a major event come through the community, right? And then 911 lights up and they get a whole bunch of calls, you know, for different events. That can be challenging sometimes. But again, if you're shooting for 90 times out of 100, generally does well. Which leads us to the mapping. And for those that may have been here, when, was it Steve Knight and Todd, or Todd that came and presented? Both of them came? Okay. So some of this will look familiar. The GIS and modeling, again, there are recommendations. NFPA 1710 really doesn't apply, but it's a standard. They talk about a 4-minute travel time. The Commission on Fire Accreditation says 5 minutes and 12 seconds. ALS units at 8 minutes. Given the overall 90th percentile that you currently have today, current level of performance in the community is 10-minute travel time. We looked at that, and then we also looked at an 8-minute option and a 13. I'm going to focus on the 10 and the 13. And again, remember the goal is to try to make sure that you can leave a station and travel to an incident within that 10 minutes or that 13 minutes, 90 times out of 100. The assumption is in the modeling, if we can do the next slide, is that there will be a unit available. This is the current heat map. This is very similar to what it was in EMS. You see a lot of blue. If you look in the lower left right-hand corner, if you look in, sure, it's a little tough, isn't it?
Yeah.
In the lower left-hand corner, there's a shade. What the computer system does is it breaks it into quintiles, so 20 percentiles, so 1 to 5 sections. The blue are the lowest demand. The red is a hot spot, typical of a heat map. And of course, here within the city, Hudson is where the majority of calls are, but you'll see a little bit of yellows kind of bleeding through to some other locations, and then the locations of the fire stations. So you do have a heavy concentration of calls. Again, not unusual, I think, to anybody in this community, that occur here in the city. If we look at the 10-minute travel time, the next slide, if we could. So this looks at, assuming you had a unit available, how many stations do you need to cover 90% of the risk based on the historical demand? That's all this tells. Doesn't mean it's absolute, what you're going to do for the outliers, but you would need only 11 stations. Again, the way this works is we have the station. Okay, I should probably look on mine here. It would be a lot easier for me, wouldn't it?
Easier for me.
It's easier for you. Yeah. I can move it closer if you like. Station 12. I assume that's here somewhere, right?
Not too far.
Not too far from here. Has the majority of calls, 37% of the calls, 2,998 calls, and then the total capture. After that, it's station 55. That had another 1,000 calls. The total capture, in other words, between those two stations, they took care of 4,007 of the 7,864 calls we looked at that we were able to map. That's 50%. And as we just keep marching along, based on the order, which stations have the greatest ability to capture calls, assuming the same pattern exists, right? It's the stations listed in that order, and at 11 stations, 91% is excess. There's nothing magical about it. It's just an analysis, a way to look at it. But as you look at infrastructure long-term, as you look at the need for stations, as you look for where's the biggest benefit going to go if we have to deploy something new, if we're going to do something different, those are the stations you would want to focus on first, right? Because that's where the majority of calls occur. This is helping do in a very, objective manner. It would take 11 stations. Obviously, if I use the term take the foot off the gas and said, look, we're not gonna do 10 minutes. We're gonna move it up to 13 minutes. We can do the next slide, Kelly. The reason I chose 13 minutes goes back to that one slide showing the performance, recognizing that you've got all volunteers now. So people have to go respond, get a piece, and then get there, right? If you had somebody in the station, daytime as an example, where people are working, if there was somebody in the station, you would not have as long of a turnout time, right? They'd be able to get on the road more rapid. 13 minutes is the closest approximation to that. And if you did that, you would focus again on these different stations. Actually, the order changes. Some of you notice that station 57, 58, 80, et cetera. So it's just a different way of looking at it. That would be if you had somebody in the station or with the vehicle at that location already, and you didn't need them to respond there. That's why we chose that one just as an example. Okay. So, Kelly, if you could. So the conclusion from the GIS analysis, using the mapping system and looking at call history, the way it's occurred, that the existing system has more fire stations than the current design and performance require, assuming 10 minutes is adequate. And it also reflects the ability to reduce the number of current facilities if that was needed. You're not going to do that now, generally. But as time marches on and there's a need to spend dollars, right, to rehab a facility, to replace a facility, whatever, the question is going to be, does that facility add value to the community as a whole? So this is a way to help look at that, okay? That's really what that's about. Okay. Next one. This was also, and this is more or less taken from the EMS report that was done for PJ earlier by Chief Knight and Todd. Medical volunteers and first response. In the last 3 decades, if you look at the NFPA data, it's kind of interesting. In the last 3 decades, the number of structure fires, the number of fire fatalities, and the number of fire injuries in the nation have basically been cut in half. And yet the need, we've done a good job. We have, better building codes and, just better protection. But the need for EMS, for emergency medical response, community expectations have changed dramatically. That's gone up 300% in that same time frame. So we see that shift, and across the nation, we see a lot of communities grappling with that, right? I'll look at PJ and go, I will allow him to opine on that. But with that the case, you do have 6 agencies that are first responders, medical first responders. Of those 6, besides the fire-related calls they did, 56% additional they did, 484 first response. And so there is, if you go to the next slide, Kelly, that existing program was one that was written in there. There may be an opportunity to expand that. And as you look for a projection moving forward, the opportunity to do so, I would encourage you to take a hard look at that. And PJ working with the fire coordinator's office to look at that, because you've got resources. You've got people, again, I talk about people that want to respond. Medical's driving the demand now. I mean, in suburban areas, 70-80% of what the fire service does is EMS. That's what it is. I was an EMS chief, So having that opportunity kind of balances. Now, it's something additional to put on the plate. If you're having trouble with volunteers, do they want to be medical first responders? What is that? What are those opportunities? So that's something to consider. But it may, excuse me, maybe an opportunity to actually incentivize people as well. Okay, next slide, if we could. So this is more for elected officials, board of supervisors, all the townships, etc. Governance. I'm a former fire chief. I'm also a former city manager and a county administrator.
Bruce, can I interrupt you for a minute?
Sure.
I'm having a tough time hearing because of the conversations in the back. Would you guys mind keeping it down?
And I'll try speaking up a little bit. Sorry.
No, you don't have to. You're fine.
So system governance. So in Columbia County, looking at the tax records, looking at property appraiser, looking at all the information that we developed. While the city has their own fire department and funds that separately, the remaining 30 agencies receive the majority of their funding from one or more of 44 separate special districts. There are 24 fire districts, and there are 20 fire protection districts within state law. Excuse me, within state law, those are structured a little bit different. The next slide, if we could. I gave here some information from the New York Office of the State Controller. When people talk about government, local government in particular, accountability, transparency, et cetera, et cetera. There were some observations made by the New York State Controller in 2017. I gave the citation that fire districts, the way that they're structured, are a little bit different. This is a problem throughout the nation, but oftentimes the districts have annual elections. Oftentimes voter turnout is extremely low, right, in those areas because they're off cycle from other elections. They're not subject to some of the laws that the county has to comply with, that the city has to comply with, the townships and other entities have to. So the last segment there, based on their work with fire district, the state comptroller noted challenges often exist with the ability of governing boards to provide adequate financial oversight on the strengths of, internal controls. You're asking people to serve on a district board. That's not their expertise. And if you have too many of them, or unless there's a system in place, so we just put that fire districts in this regard may be a little bit more challenging. Next slide, if we could. Here was the other thing, just the number. This did kind of jump out at me, and again, I'm a bit of a government geek. There's 31 fire agencies, but 44 special districts, right? That means that on average, this reflects an agency, a fire company, one for every 1,977 residents, just under 2,000. And if I look at the separate taxing opportunities, there's one taxing entity for every 1,362 residents. The fleet inventory, when we look at the fleet, 40 companies, 63 fire engines, 2,004 calls, right? Oftentimes, again, not unusual, but that is a lot of equipment and apparatus. 63 engines, that's one for every 987 residents, right? The number here, based on all of this, the number of companies, the next slide if we can, it just really highlights the fault. It's a decentralized system. There's no single point of focus or coordination. And because of that, there is arguably an inefficiency in the system the way it is today. It's overcapitalized with apparatus. It's overcapitalized with stations that don't add value. That's just, now, there are no villains in this story. I'm going to be very clear on this. Systems develop organically. Nobody got together 30, 40 years ago, whatever year you want to use, and said, I've got a plan. Let's create, 40. Nobody did that. It was based at that time on the needs of the community or that area of the county. But as I talked about, in 30 years, the fire activity has been cut in half. If EMS calls have gone up dramatically, if all these changes, the logical question is, and you're to be complimented on at least undertaking the study and asking the question, is there a better way to do it? Have things changed enough that we should look at it? What I just showed on the governance side would indicate that. The next slide, if we could. But of course, funding and governance are the two most difficult things elected officials and, senior administrators have to deal with. There's a slide in there, we'll come to it in a second, but the tax rate across these various taxing entities. Now, again, different parts of these districts have different valuations, right? Overall property valuations. So the tax rate applied to them, though, ranged from 0.32 up to a high of 1.38, a fourfold increase. Altogether, they raised $6.73 million. It was interesting that some of those agencies in the top 25% of tax rates, so those people living in those areas have one of the top rates for fire protection, also have the lowest number of calls. So again, just kind of one of those indicators. No villains, not criticizing. This is what the data says, though, that it's just, is that the best way to do it? Yeah, I just did the math, nothing more than that. If you were to look at something countywide, if you were to try to do something countywide, the rate would be 0.76624. That's what the rate would have to be to still generate that $6.73 million. That's just information. Again, that's not a recommendation. It's just an observation for context. Next slide, if we could. Actually, we won't stay a whole lot on this one. This just shows for each of the districts, the assessed valuation, the amount rated, the tax rate. This was all drawn from your websites and the various sites that are used to do that. So the conclusion, the next one, Kelly, is that tax rates and tax revenue are not well correlated. They're certainly not well correlated to community demand for services. And agencies, some of the agencies providing the least amount of services because the demand's not there, also have some of the higher levels needed from their communities. Again, no bills, it's just what's happening. So what to do about it, right? That's what we're supposed to try to offer. These are alternatives now. The next one, if I can, Kelly. And I'll move through these four and then I'll be ready for questions. So the first one is option 0, status quo. Continue to work with the fire coordinator's office, provide some level of support, particularly with regards to training, physicals, etc. for them moving forward. I'm sorry, Kelly. There you go. So that's option 0, but the potential efficiencies, well,
sorry.
that's all right. But the efficiencies that may be desired, that we heard from qualitatively, what the data seems to reflect, wouldn't be there. Option one is the first level. These kind of build sequential, right? And again, they're all options. This is an increased county coordination in apparatus and capital equipment. While apparatus and capital equipment are kind of one-time expenditures, so for those elected, you have to make those policy choices every year in the capital. Doing that, even if you were to look at HOSE, SCBA, other opportunities that say, look, we're all going to buy off the same contract. County can go out, they'll bid it. That ensures the accountability with transparency and stuff. We'll bid it, we'll get a price, they'll have a greater opportunity for volume pricing because multiple companies need hose, multiple companies need certain equipment throughout the year. You poll the department, say, what do you need? This is what we'll do. In addition to that, have a pool of spare apparatus. Look, you better have spare apparatus. Company goes down, their engine's done, you got to have it. But I've done this personally as a chief. I've done it, recommended at multiple places. The number that you need, you could probably reduce your fleet significantly if you had a reserve pool of, let's say, 10, 12 vehicles, right? They'd be available. They could be at the training ground. Somebody needs one of the engines goes down, piece of equipment goes down, they call, not a problem, we'll send you one. Put holders on it so they can even take their number and their station and drop it in there so they get the identity, but it's less costly overall to the community if you do that rather than, and just that last, that second bullet point there, just saying, if the fleet was reduced by 20 pumpers, just based on what are being sold on the websites in New York area, you could generate 1.3 million. Do something. That's just an example again. But again, that current capital equipment standardization would also benefit the training, mutual aid, spare, people pulling up with engines. I don't care what company came in. Again, the equipment starts becoming more uniform. Everybody's very comfortable. Makes sense? So that's option one, or option two, I'm sorry, or option one, yeah. Option two, sorry. That's you and me both going there, so this builds on that. Option two becomes a little bit more, right? In this one, building on that goes further by addressing the redundant fire stations, fire apparatus, capital equipment, as well as developing common policies and procedures. As this gets more, with more of a centralized approach, it is not the intent to say, okay, county, you take it. That's not the intent. The intent is for the chiefs to either themselves or designate somebody who is going to work and get in the room, and they're going to pound out common operating policy procedures. They're going to do that, which they have a bunch of that now. I understand that. But it's to take it that next level, to look for those sort of things, to do the specifications on the vehicles, right? So when we do need to buy a vehicle, you can do a specification. The trucks start being more, I can tell you from running significant organizations, the more your apparatus are configured the same, that anybody can walk up and know that if I want a Halligan tool, I know where that is. It's in the left rear compartment. If I need the spreaders, that's in the right front compartment. I know where stuff is. So there's benefits to that. That's where the long-term use of that. This group would also be the ones that when somebody says, look, we need to make a reinvestment in a facility, the first question should be, okay, understand the need. Do we need to rehab or make an investment in that facility? Is that the best use of the dollars? Is there another way to approach this? Could we relocate a piece? Could we do something else? Could we, whatever. This group would be the ones helping make those decisions. It is a collaborative process. This alternative probably has the greatest ability to improve the county-wide protection because the county's not running it. The county is facilitating this. And the chiefs and those companies, those agencies come to the table and express what they need. And it does require, unfortunately, but it requires that collaboration, right? But we understand that today, with the recruitment retention problems, with limited dollars, with increased expectations of the community, with shifting expectations in the community, there has to be a smarter way of doing it. This is then one way to do it. The last option, number 3, is to consolidate into a smaller number of districts, perhaps. You already have that to some degree. You do operationally, right? You have North Battalion, South Battalion. Did I get those right? The battalions? 4, right? Yeah, so 4 battalions. Also, at some point, there may need to be consideration of whether you need some day crews. So again, this is a very common thing that we're seeing across the country. I said 70% of the calls occur during the daytime, especially Monday through Friday. So some places have hired, generally part-time initially, a couple people to staff the stations that need it the most, based on the GIS, and during the daytime, right? Volunteers are still toned out, they still come to supplemental, but you can get somebody on the road more quickly. And if you have those people, you want to make use of them. So again, the medical first response program also plays well into that as well. So this kind of takes that to that next level, right? So that's what that does. So that deployment of daytime crews would enhance turnout, enhance the response times, allow for an increase in medical first response. Those are kind of the various options that could be considered by the committee, by the community, by the board of supervisors. And with that, I'll take any questions the committee may have or others. Mr. Chair, any questions? Yeah.
I'm just looking at your numbers. I think you're off a little bit. There's more fire agencies than your numbers reflect. For example, the Alsace Fire District contracts with 2 independent fire companies. Also, my numbers show, and I got this from something totally different, but there's 18 fire districts in Columbia County and 16 fire protection districts.
Yeah.
And that's from real property.
Yeah. So one of the
I
challenges.
don't know how that affects the numbers, but
A little bit generally, but so it's always the source, right? So this has been a very iterative process. I know George is on the phone. We've communicated a bunch of times. There's been, George, you can help me, the 2 or 3 different versions of this that have been sent and reviewed, the raw information we got from the fire coordinator's office. There oftentimes is where people will say, well, those numbers don't line up with my numbers. Well, you just kind of have to use that. That's why I was very clear at the beginning, why we use CAD with the districts and stuff. That I drew from, the assessed valuations and the tax bills from all the, I pulled that from county side. So there may have been something that wasn't updated.
I got it right from real property.
Yeah, so.
County real property.
And to the degree that we need to, we can go back and look at that. I'm assuming the assessed valuations are fairly close.
I don't know. I'm not sure
Okay.
which.
Yeah.
And the tax rates that I have are from, and again, I got this, I'm a fire commissioner.
Yeah.
In a fire district. I got it for our purposes, but the tax rates I have.
Yeah. If I remember, I think I used the 2023, the most recent one at the time. Well, but this is when we were putting it together, right? So you probably have, there might be an update since that. The larger terms are going to be, yes, Chief.
Just curious on how many chiefs did your people talk to?
Is George on the line?
George?
George?
I am. The reps from Fitch talked at the battalion meetings. We had all but at both battalion meetings that we held to kick this process off, we were missing 10 fire departments from the county. They had reached out, they had talked to them all at the battalion meetings, and that was where they got their initial information from, and the feelings of the chiefs that were present were those 3 highlights as to the initial problems of what they foresee as the bigger challenges for the volunteer fire service. I'd just like to say that you know what, this is an average study. It's a study that took a pretty high level view. It didn't get down into real, every little call that went on, but I think it gives us at least a jumping off point to be able to have quantified conversations about the directions to go forward. I mean, I don't think any of these recommendations are taken blindly or anything like that. I think we're looking at some point that's very unemotional, very data driven, that has nothing to say about anybody in particular other than this is what the CAD report told us. And I understand, I've already had plenty of conversations recently about the CAD data isn't always accurate. The CAD data is this and all. It's just a starting point. It's not that this has become the Bible of anything that we're going to do. It's just some place to get started from so we can have some quantitative conversation going forward for everybody.
Brandon?
So when you were talking about the 10 busiest stations, is that based on the location of the calls, or is that based on the availability of the station to respond to a call?
So it's based on, so it's modeling. So it assumes there is a apparatus to respond in every station, and it is drive time. It's no different than you would do with Google Maps or any of the other ones when you.
So it's not an actual response.
That is correct. It is not. It is modeling.
It's a big
Yeah, so when we look, that's why I pointed out the actual travel time as reported in CAD was 10 minutes, right? That's why we modeled that. So we kind of do that to calibrate the model. And then you can say, well, what happens if we do it in 8 minutes? What happens if it's 10 minutes? And you'll notice the order shifts, but it's just where the calls occurred. So wherever you can drive in 10 minutes, it captured all the calls in that 10-minute polygon, they circle around it, and then took them out of the batch. Okay, let's go to the next station. What did they capture?
My follow-up then is, how can you be sure that those were actual responses? And does that matter?
Those,
And the other, the issue I'm struggling with is, what stations have volunteers in 2022 may not be the same stations with volunteers in 23.
Correct.
The volunteer pool shifts dramatically from location to location, year to year. And how do you factor that in?
You can't, right? Because there's just, again, we have to assume a snapshot in time. The other challenge is it's based on the calls and where they occurred in 2022. Generally, unless something seismic happens, if you look at a community year after year after year, the pattern's pretty much there, right? I mean, unless something dramatic happens, that's where the calls occurred. But it does assume where the calls occurred. So that's a constant. And the staffing, it doesn't talk about the number of volunteers. It's simply, can an apparatus go from that facility and get to that call in the most timely manner?
Yeah, and maybe I missed it, but that didn't include what type of apparatus it was, because typically.
Correct.
Typically, the fire chiefs have vehicles, they respond, they get there much quicker than say, Class A pumper.
Correct.
Especially in my area.
Yeah.
Where you have to go over.
Yeah, and I kind of alluded to that in the actual hard data, that the much better than I expected performance is probably
That's
related
probably
to some of
why,
that, yeah.
Chiefs get
But,
there.
but this looked at from a station to a location where an incident had actually occurred in the prior year.
I think you'd have a graph in there about all the vehicles and cars responding.
In the data report, in the full data report, you're correct, Chief. Yeah, in the back, I think we've got every unit, so you can look at that and say, okay, that really, you know.
I don't agree with some of the stuff you're saying, but some of the, George says that we were talking at the town meeting, 5 minutes. You should have went to the fire chiefs and fire commissioners of each town and asked them how big an area they're covering, what they had in their area as far as commercial stuff like that. Okay, my town, Livingston, okay, I have an alarm law. Okay, so my 130 calls a year. Okay, there's not that many false alarms. And if you look at the data, it does show one thing. We have a problem with false alarms and wires down. Okay. And also is New York State is the #1 in deaths, fire deaths in the last 3 years. How do I know? I had 5 this year of 2023. Okay. If you would have got more information, you would have went to the fire districts or the independent companies and sat down with the chief and said, how many pieces of apparatus do you roll out every quarter, every call? My district, I don't roll every piece of equipment out, okay? But I have a higher demand because I have more fires, more actual accidents, okay? And that would give you better data, okay? We would never, I've contacted many fire chiefs in my area, okay? Nobody was interviewed.
Yeah.
Okay. It does show you some things, but the times in the CAD are not 100% right because from the time to call, I agree with you, the time to call to the time we end the call, but when we end the call, most of the time we're on scene, we terminate the call, we still got another 10 minutes drive back. I have one of the biggest fire districts in Columbia County, okay? So the numbers are not 100% right. It doesn't tell the true story, but I'm not saying everything is phony, but you never came to the fire commissioners and the fire chiefs and sat down and said, what do you cover? Okay. How big is your area? Okay. How many pieces of apparatus do you have? What do you respond that every call, everything, just certain trucks, okay? That's why I think if you wanted true numbers, you would do that. And just to let you know, I haven't been in the fire service very shortly. I got 46 years in, okay? And these are true things. I'm not saying you're 100% wrong, but I'm not saying you're right either.
Listen, data sources are important. We did offer opportunities for chiefs to come in and meet with us.
No, we were told that at that county meeting, and I voiced my opinion at that meeting, okay, and everybody knows it, but you should have went to the fire districts and the fire chiefs and sat down and said, okay, what do you cover? Okay, because I will tell you, I'm not gonna mention names, the two highest ones on that report are mostly alarm activations. Okay.
Okay.
And that would give you a better figure, which also gives you a figure that the county has a problem. Their alarm law, it's no good. My alarm one's stronger in the county.
And so I appreciate it, Chief. So that's why I was very clear where we got the data from and how we did it.
Yeah.
So, and again, people always say, we've got different data, or you should, and I understand that. We had finite dollars and time to do it. We asked for the best data source, and I will be candid and look, I do a lot of stuff with CAT, and there are challenges with CAT. But I would generally tell you, I doubt anybody's got better data than 911 office does, because they're the ones doing the dispatch and everything. But, and again, you're right, it's not 100% perfect, but it's what we've got to work with.
Next question.
If you would have looked at talking to fire commissioners again and the fire chief, when it came to the assessed valuation of $1,000 rate, okay, you would have seen in my town that I'm $1.18, but my supervisor hasn't done a reval in 25 years, and it's at 55%. Okay, that would have dropped the number down. Okay, so
yeah, a lot of variables.
Any other questions?
I'm curious about whether this is just fire or this provides any information for the county on emergency services generally. Because I saw that you were presenting information about EMS, but I'm just layperson, but EMS response is also by private ambulance service. Is that factored in at all, or is this?
TJ, you want to, or you want me to take this
I
one?
can take that. We basically did a separate study for EMS. We did that and it was presented several months ago. And since then, we have taken our EMS advisory board, which is similar to the fire advisory board, and broken it down into committee and work on some of the objectives and some of the improvements that could be made within the system. And so that was kind of a separate study, but the two do correlate. They go hand in hand in a lot of areas. Like in this study, the first response agencies that were identified, one of the things that came up in both reports for fire and EMS was the need to kind of enhance that to what we call echo level calls, which are serious calls, cardiac arrest, respiratory arrest. So we will be working together with the fire coordinator's office and with the chiefs and the commissioners to see if we can enhance that.
I'm just curious, you see the response time for fire is 10 minutes. What's the response time for EMS, for ambulance?
I have to go back and look, but it's a little different response time criteria. But I think the average response time is about 11 minutes. But you got to remember, there are 5 agencies in Columbia County, EMS agencies, not, how many?
31.
31.
Next question.
Yeah, so I appreciate sort of getting the study and getting a good picture of the data, even if there's more to add to it. I'm trying to think about like what the next actionable steps are and what we can do to sort of investigate those things. So what I'm hearing is maybe the easiest things to reach is to encourage municipalities to create an alarm activation law or sort of look at responses around that. And then the second thing is sort of what you laid out as option 1. And so I'm also curious what are the challenges or opportunities around implementing option 1? What would we look into that? And how are the fire chiefs and the fire companies responding to whether or not we should implement option 1?
Yeah. Yeah, so there's a number of things, right? And there's, as I said, there's not a specific recommendation. Option one said they kind of build on one another a bit. So generally, you would probably need to start with some of that anyway. The Fire Advisory Board, working with the Fire Coordinator's Office, would be a place to have that initial discussion. Then come back to the Public Safety Committee, make specific recommendations on what they want to do.
You know, I want to be clear here about the county's position on this. The county did an EMS study, which I think was imperative that we did that. And there's quite a process to go through. This is very preliminary. We were asked if this same company could do one for the fire companies, and the county paid the money to do that. We're not here in the county as the chairman of public safety. I think I don't want to speak for Matt, but I think Matt will agree that we're only here to help. We're not here to try to guide this, push this, drive this. These are separate fire companies. We have no dog in, fighting this at all. If we can help, fine. But George will run with this. There'll be a million more conversations, discussions, what each fire company decides to do is up to the fire companies. The county's not driving this. I want to be clear here. This data was to be given out in an effort to hopefully help. Whether this data is somewhat skewed or not, I think it still gives an overall picture of what is going on in the county, and potentially what the direction of, I think the fear is for most people is that as volunteers start to go away, what happens? So this was an effort to sort of get some data, get some information. If we can help, we're here to help, but we are definitely not trying to drive any fire company in any specific direction. We're happy to help, happy to have more meetings. I'm sure when George gets back, there'll be more meetings, but I just wanted to be clear that it was really in an effort to get some data out, maybe open your eyes to some things. If you think this is all hogwash, then it's hogwash to you. I don't know what to tell you, but I think there's some valid data there, some valid information that you can bring back to your fire companies, talk about it, speak to your supervisors in your own towns, see if there's any, directions you can go in. The only thing I will say, and I have no issues with my local fire companies, I want to be clear. Sometimes there's a lack of communication, and maybe it's even my fault, between the supervisors and the actual fire companies. We're not adversarial at all. I think some towns are maybe between the boards and the towns, but we're surely not. Our fire company does an amazing job. We're thrilled to have them there. We're thrilled to have all of you there. So I want to just be clear that we are not driving this in any direction other than to get the data out there. So.
And I think when we asked to have.
George, your hand is up. I'm sorry.
Yeah, I'd just like to reiterate that the fire chiefs, we haven't even talked to all the fire chiefs yet about this report. We sent it out at the same time we sent it to Public Safety Committee and the Fire Advisory Board so that everybody was getting the information at the same time. We've got multiple conversations to have about this, and we're not advocating one thing or the other. It was more just to be able to have information available going forward so fire districts and fire companies can start to have conversations to make good decisions. That's all.
Third question?
The only thing that, I have most of the numbers, the tax numbers were pretty much on. We're a small district, so we're on the opposite end of what Joey would be on. But the one thing it doesn't cover, when you say structure fire is 2 hours and 27 minutes on average, that's from start to finish. What it doesn't include is the time that we go back and put all that stuff together. And somebody who doesn't understand the fire service would say, oh, that's only 2 hours and 2.5 hours for a structure fire. It could be 8 hours for us. Yeah. And that's the only thing I want people that don't understand the fire service. There's a lot of time that's not clocked at 911 that we have to spend there to get it back in service or anything. So that just wasn't addressed in there. And I think maybe you think it's just common knowledge, but some people may not know that if they're not in the service.
That's a good point. Fair point. Yeah.
Questions? So I think at this point, as I said, George is going to have a bevy of conversations, information. Any way we can help from public safety, please let us know. I'm sure there'll be more conversations between you and George. And even if it just gets your fire companies talking, if you do nothing, you do nothing. But I think it was important to at least bring some light to this. That's all. And I appreciate everybody coming. Thank you very much. Thank you. Thank you for your presentation. I need a motion to adjourn. Motion to adjourn. Second. All in favor? Aye. Opposed? So carried.